How do you deflate the cuff for auscultatory blood pressure? Have you ever wondered how medical professionals accurately measure blood pressure? One key technique is the auscultatory blood pressure measurement. Today, we will focus on an important part of this process, deflating the cuff. To start, the cuff is inflated to a pressure that is higher than the estimated systolic blood pressure. This is usually about 30 millimeters of mercury higher than the point where the radial pulse disappears. This ensures that the artery is completely blocked, which helps avoid errors in the reading. Now, let's talk about how to deflate the cuff properly. The pressure should be lowered slowly and steadily. Aim for a rate of about 2 to 3 millimeters of mercury per second. This controlled deflation is important because it allows the clinician to listen for Korotkoff sounds through a stethoscope placed over the brachial artery, located at the front of the elbow. As the cuff pressure decreases, the first clear tapping sounds you hear indicate the systolic pressure. This is known as Korotkoff phase 1. These sounds show that blood is starting to flow back through the artery as the cuff pressure drops just below the systolic level. Continue to deflate the cuff at the same slow rate. Keep listening until the sounds become muffled and eventually stop. The pressure at which these sounds disappear is the diastolic pressure, also known as Korotkoff phase 5. It is a good practice to deflate the cuff slightly beyond where the sounds stop, about 10 to 20 millimeters of mercury. This helps confirm the diastolic reading. Finally, fully deflate the cuff to avoid any discomfort for the patient. Accurate deflation is essential when assessing hypertension. If the cuff is deflated too quickly, it can lead to missed or inaccurate Korotkoff sounds. This could result in incorrect blood pressure readings, which may affect diagnosis and treatment decisions for individuals with hypertension. After taking the measurement, it is advisable to wait at least 2 minutes before repeating the process. This ensures that the results are reliable. If there are significant variations in readings, take additional measurements and average them for accuracy. In summary, deflating the cuff slowly at a rate of 2 to 3 millimeters of mercury per second while listening for Korotkoff sounds is the correct technique for auscultatory blood pressure measurement. This method is fundamental in evaluating and managing hypertension effectively.